Okay. Thank you for joining us. Um, Sorry, we are starting a little bit late, and it's due to technical issues. We'll get these technical issues very soon, someday. Thank you for joining us. This is Living Health TV. I am Dr. Gbenga Adebayo. If this is your first time of joining us on the show, I am a public health physician. I finished from Obafemi Awolowo University, Ile-Ife, where I graduated with we call it MBCHB, Bachelor of Medicine, Bachelor of Surgery, and I've gone on to do my public health Masters in Public Health from the Hebrew University of Jerusalem in Israel. And today it's my pleasure to be with you for us to examine the issue. What we are looking at today is, of course, the issue of headaches. We are taking a look at headaches, and we are going to be talking about causes, symptoms, and simple remedies, and what you can do to keep yourself safe from headaches. Thank you to everyone that is joining in. If you're watching this live from all over the world, wherever you are joining us from, please tell us where you are joining in from. And of course, if you are watching this after, you are following after, we would appreciate it if you can just uh, drop a comment. Yes, just drop a comment right there below so that we can know where you're coming from, answer your questions, and hopefully you will find this session very, very enlightening. Okay, so headaches. That's what we want to talk about. Everybody at one time or the other in their life will experience an headache. You not well. Most people, almost everybody, at one time or the other, gets to experience um, a headache. Now, the question is: are all headaches the same? What causes headaches? Are headaches are they do they come in one size fits all? Is it what causes? No, so it's important for us to realize what headaches are, what causes them, and for you to know the red flags, what we call red flags, so that if you experience those red flags, or someone that you know experiences those red flags, you can quickly do something about them. You can quickly take a stand and do something about them, because not all headaches may be simple, may just be something innocuous, something that won't harm you. But there are some this if you see these red flags, the that headache may be a sign of something more dangerous, something more sinister, and you will need to quickly do something about it. So, what are headaches? Simply, a pain in your head region, your head, face, and neck. That's what we tend to classify as headache. Now, the important thing to know is that the brain itself, the brain itself does not have pain receptors. So, if you are feeling an headache, it's not really your brain per se. It's not your gray matter or your white matter. It's not your brain. It's the adjoining tissues, the blood vessels, the nerves, the muscles, the bone, the meninges, the covering of the brain. Those are the things that sense and can experience pain. But the brain itself um, cannot. It doesn't have pain receptors. So whenever we have an headache, that's an interesting fact that I thought I should put out there. Now, as far as headaches go, we classify headaches into two broad groups, so to speak. And those two broad groups are what we call primary and secondary. What does that mean? Primary headaches, and those are the more commoner uh, types of headache that you have. Those are the headaches that they happen as a result of something that is happening in the brain. They occur that something is up in the brain, and then you have what we call a primary headache. A secondary headache, as opposed to secondary headache. A secondary headache is something that you have that gives you a headache because of something else. Yeah, because of something else. So if you take care of that other thing, the headache goes away. So primary and secondary, but as with many things, as with most things in medicine that we call primary and secondary, the primary is the more common one. So the primary headaches account for over 90% of headaches that people will have. So that's the more common one, primary headaches. So now primary headaches, we group them into, we have three main groups, three main types of primary headaches. And there are a few other very rare, but maybe I'll mention them if we have time. But the three big common ones are what we call tension headaches, cluster headaches, and the one that a lot of people, when I was a kid, people used to talk about it, a migraine, migraine. And that's probably maybe that's the word you'll be more familiar with. Oh, I have a migraine. Oh, I have a migraine. Oh, there's migraine. So what's a tension headache? What's a cluster headache? And what are migraines? Okay, so let me start with migraines. Migraines uh, often occur on one side of the brain, one side of the head. You just feel a pain on one side of your head. And as opposed to a tension headache, migraines are throbbing. Huh? So you just feel something pulsing in your head. And migraines can affect both sides of the head, contrary to what a lot of people believe. You can have a migraine and it's affecting both sides of your head. But the key thing to note about migraines is that migraines is as if something mm, they're pulsatile, it's just a throbbing pain, often on one side of the head. It could be severe. It could make you to feel like vomiting. You know, there could be nausea and vomiting with migraine, as opposed to tension headache. A tension headache happens broadly across your whole head. You just feel like, it'd be like a band. Somebody, people, you want to say my head is like something is like a vice holding my head together. That is suggestive of a tension headache. It's also important to know that with tension headaches, you may um, you will not be vomiting. There's not going to be a sign that you want to vomit. It's not going to be a problem. It's not likely to be a problem in a tension headache. Cluster headaches are not as common as tension headaches and migraines. Cluster headaches, severe in nature. A tension headache may be mild to moderate, but a cluster headache is something that is severe in nature, may affect one eye, and it may throb, it may be constant, but it occurs in time frames, in, like as the name cluster suggests, it beats. So 5 minutes of severe pain, and then you have it goes, and then you have another wave of that. So primary headaches, those are three common types of primary headaches. And then we have some other ones. We have postcoital headaches. Some people, as they are having sex, they can have headaches, and it gets worse as they want to have um, orgasm. And then we have headaches, of course, that's related to medicines. Although I would probably put this under a secondary headache, but some people try to look at it as as a primary headache because it's related to, you can't, it's something that is happening directly in the brain. I'll talk about it a little bit more later in the program if we have opportunity. So those are primary headaches, and then of course we now have secondary. 10% of headaches probably will be secondary headaches. And what are these? That means something else is causing it. It's happening as a result of something else. So it's either a tumor, a tumor in the brain, something is growing in the brain. Of course, the head is a closed space. So if something is growing there and that thing starts to take space, it's going to cause, it's going to stretch the tissues in the, so nerves, blood vessels, and then that person is going to have dull, dull pain that is just there, never goes away. So that suggests to us that something, the space occupying lesion in the brain. Stroke, yeah, this. So that one you have what is like what some people refer to as a thunderclap headache. It just so it's It's like lightning or thunder, like like lightning is it doesn't make the sound. The one that makes the sound is the thunder. So a thunder clap in your head, sudden ringing, that suggests that a sudden event in your brain and poof. So that could be as a result of stroke. Infections, yeah. So you have an infection, meningitis. I had a friend, some it's painful, very painful for me. Um, he just came to meet me. Oh, doctor, pastor. He said, see my hand. My hand is shaking all by itself. It just starts shaking, and sometimes I have headache. And we're wondering what it is. I said, okay, go for checkup. Let's see, doctor. Let's what's happening, pray and all that. Lo and behold, my friend had meningitis, TB meningitis, and that was what was causing his headache. That was what was causing the symptoms. I will refer to this later again when we're talking about signals. Not all headache should be ignored. It's just there. It will go. My friend died. He died of TB meningitis. Thank you, Michael. Thank you for joining us. Please share with friends. Let people know we are discussing headaches. Yeah. So secondary headaches. If you're just joining in, you can watch this later and just catch up with where the things that we have said. So secondary headaches. Yeah. So infections, medicines. Now I was trying to say that. So some drugs, illicit drugs, even normal medicines. Any prescribed medicines can give you headache. And paradoxically, using analgesics, just using analgesics and just keep on using analgesics can give you headache. So that's a drug-induced headache. So be careful with how you use analgesics. If you see that you're using analgesics and they are giving you, you're starting to have one headache, as soon as you use it, you have to use it again to have a headache again. So it may be that medicine that is making you to have um, headaches. Okay, so secondary. So secondary just simply means what is causing that headache is not something primary in the brain, or it's not those three key types that I've described, but something else that you need to address and you need to take care of. I want to say here some red flags. If you see that you're having headaches and you see these flags, you need to go see your doctor. You need to go and see your doctor. What are these flags? Number one is if you have systemic symptoms. You're having headaches, and then you are now seeing things happening to you, not apart from that, not your head, your neck, not your face. It's now you are now seeing like that, my friend, that was having headaches, and then his hand was shaking. He was having, trembling so you're having headaches and you're having fever with the headache. We need to take a look at that. You're having a headache and you find out that it's affecting your appetite. You are vomiting, just vomiting incessantly. No, we need to take a look at that headache. So you're having an headache and you're also now having neurologic symptoms. Huh? No? So tremblings, tremors, tasting things are tasting funny in your mouth. You can't taste, or one part of your body, you can't move one part of your body, you can't move your leg, you can't walk properly. It suggests that headache is not just something you should take lightly. You need to take it seriously and go see your um, uh, physician. If an headache is sudden, sudden onset, it just starts, boom, like the thunderclap headache, like we described earlier. That's serious. It's not that your headache, that may suggest that something, an event, a catastrophic event, has occurred that needs to be addressed urgently. If you are starting, you just have new headache after 40 years, you are 40 years old, after 40 years of age, young, that may be um, that there's a problem with your headache. We need to find out what is causing that headache. And then if you've been having headache repeatedly and it's getting worse, it's getting worse. It's not getting better, it's just getting worse. It's getting worse. Please go see your doctor. Don't take it for granted. Don't take it for granted. And then it's also important for everybody to know their triggers. What are the things that trigger your headache? What are the things that happen to you that because if you watch it, today we're talking about headaches, signs, symptoms, causes, and we're talking about remedies. Part of the remedies that I will talk about, and we can start to talk about them now, is when your head is when you start to get headache, especially for the three primary headaches that we discussed earlier, often, more often than not, there are triggers that bring it on. So if you can remove those triggers, you can prevent things. Yeah, does that make sense? So if something is what is triggering and causing you to have a problem with and just have this headache. Some people, their triggers are human beings, So because stress is a trigger. When we find ourselves in a position where we are stressed, we are riled up, then headaches may be the result. Headaches may come, headaches will happen. So if you find out that um, anything that you can do that can help you distress, anything that you can do that can help you cope better with stress will help you manage headaches. Yeah. So you need to know your triggers and cope with that trigger. Alcohol is a trigger. That's why you see people hangover and all that and all that. And all. So if you see that the headache you're experiencing is tied to alcohol intake, that may be a trigger that you need to avoid. Some people, it's some certain medicines. Some people, it's coffee, all these neuroactive substances. If you find out that when you take these things, they result in headaches, then please reduce them. For some people, it's bright lights. Like I'm in the studio now and there are lights shining on me. If I start to say, oh, it's your screen, the glare of your screen. Yeah, that can give you a tension headache. It can give you a tension headache. So if you find out what are the things that what is happening around me that is serving as a trigger for this headache. In fact, it was miraculous for a friend. I was speaking with him many years ago, and he said, "Doc, I've been having this dull headache for a while. I don't know what's happening." And I looked at his screen, his full screen, was the highest brightness, and he was incessantly fooling himself that he was a football manager. He was playing the championship, but that thing is could be quite addictive. So it's there playing. I will win. I will win the next one with this. The brightness of the screen, straining his eyes, giving him tension headache. And I told him, "It's your screen. Can you reduce your screen brightness?" And he reduced it, and voila, headache was gone in a few minutes. So it's look for the trigger. Take care of that trigger. Sleep, lack of sleep. Last week we discussed the power, the importance of sleep. If you missed that video, it's available. And we are working to, yes, we noticed, I think today our streaming is better. We noticed the streams of previous days, there's that drop frames and that jerky, and then you look like you're a robot. But this is better. But you can still watch, and we're trying to perfect and put some of those things, make them into a podcast so that people can listen in without being distracted with poor visuals or visuals that don't measure up to what they want. So if you are here and you're still watching, I know some people are online. Thank you for Michael. If you're online, you're watching, please drop a line. Let's know where you're watching from. Let me know that we are not speaking to the air. Thank you for joining. It's a pleasure to bring this your way. Thank you again. So that sleep video is there. Go watch it. And let sleep is important. Lack of sleep will give you headaches. You wake up groggy, hungry. If I may give you more than headaches, cause whole lots of problem to you. So medications, like I mentioned earlier, all this can be a source and triggers, so to speak, for headache. So let's deal with them. Let's deal with headache with all these triggers and be the better for it. So if you find out that you are having repeated headaches, we are sure we've excluded that they are not secondary. It's not due to hypertension, that something, troubling your brain and hypertension will kill. So I hope everybody, yeah, is aware of their blood pressure, checking their blood pressure regularly and monitoring it, all this other stuff. So if you are sure it's not the secondary and you're having a primary headache and you're trying to talk to your doctor, see your physician, and let's even know if you're having repeated headaches, the headaches has been there constantly. Please, that's a red flag that you need to go get your doctor to help you check it out. See your physician. So, what are the remedies? What are the things that we can do, particularly for primary headaches? For primary headaches, number one, what can you do? Relax. Yeah. So a lot of people, giving them primary tension headaches are pressures, inability to cope. You hear bad news, you hear things going awful around you. So if you can find things and avenues that will help you to relax, then you may be better able to cope with the headache. So let me make the framing better. Is that better? Okay, if you are watching, it's better. Please let me know. It's better. Or if you prefer that it be that way, I'll go back to that way, like this. Okay, so like I was saying, if you lifestyle changes, look at those triggers. Do an audit of your life and identify the triggers. Is it alcohol? Is it stress? Is it some toxic relationships that you may be in that puts you under pressure and gets you riled up and gives you a tension headache or precipitates migraines and all? So you need to find out, is it some medicines? Is it the weather? For some people, it's a certain environment, a certain when something is up in the air, a certain ambient, they just they tip over and they have headache. So find out what's the trigger, what triggers me to have headaches, and then deal with that um, trigger. Go for things that help. A massage may be helpful. Yeah, scalp massaging, neck, in fact, body massage. The cold compresses may also be helpful. Just putting a cold compress on your head to cool off, to cool down. Music, uh, find a song, find an artist, relaxing, calm music. This may help you deal with primary headache. And of course, this lifestyle and this non um, uh, pharmaceutical remedies, if they don't work, and even if they work, no, you if they don't work, rather, you may need. What I was going to say is that even if you are using pharmaceutical remedies, these things are still good because they help your general well-being, general life um, outlook. So if these don't work, then you may need to see your doctor for the right medicine for the right type of headache that you have. Because what is best for a tension headache may not necessarily be best for a cluster headache and may not necessarily be best for a migraine. That you're using something for migraine doesn't mean that it's the best for a tension headache. Of course, everybody knows the good old analgesics that they use, they pop. But like I said, popping analgesics, not just popping analgesics and just popping and popping and popping it in itself can give you a headache. I'm telling you, if you're abusing it, you're just using it, you can have analgesic induced headache. So see your physician. And those red flags that I mentioned, see a red flag, your sudden headache, systemic symptoms, you're having something is happening, neurologic symptoms, external, your leg is twitching, your hand is switching, or one part of your body is weak, or you have a fever. Don't just take that headache uh, to be, especially if the origin of that headache is the brain. Not that, some infections may present with headache. So if you treat those infections, that headache will disappear. So that's why it's secondary. Yeah, even the common infection in the tropics, which is malaria. Part of what you can have with malaria is to have a headache. So, but Malaria is thankfully, and good news, we got a vaccine approved for malaria during the week by the WHO, and that's tremendous. Somebody might say 40%, it just present 40% infection and then just a lower percentage, but that's still a lot. Malaria affects millions of people. Imagine if you can prevent 40%. That's a breakthrough, and we hope and we believe upon this first one. There are a few other vaccines undergoing clinical trials. One of those vaccines prevents 70%. That's huge. That's huge. You know how much some people spend every year on malaria. If you have 5 kids and those 5 kids bring down malaria, you don't have insurance coverage. That's a lot of money. But even beyond the money, the care, malaria kills a lot of people. So it's great news that we have a vaccine for malaria. So we're talking about non um, secondary, anyone. So see your physician. So if you see systemic symptoms, you see neurological symptoms, systemic neurological symptoms, you need to start to say, whoa, what's this? Sudden onset. It just starts suddenly, suddenly. It just came out of nowhere. That may be a troublesome headache that is getting progressively worse, That may be a problem. So if you see any of these red flags, say it's just headache, I'll be fine. Please go see your physician. Okay, as we normally do now, let me try to say some of the things where we don't the same. I see them for area way. So if you don't follow us now, the thing we don't talk about now headache. We don't talk about headache. A lot of times you know we all headaches be the same one. Just like because somebody look like something, no mean you say it be that thing. So if you want to say headache, they're very common now. Everybody at one time, most people at one time or the other in their life, then go get one kind of headache or the other. Because they say headache we call some primary and we call some other one secondary. Primary headache, we say that thing now for the brain, that thing just originates. That's now where it come from. And those primary headache, we say then get three types. We dey call one tension headache. That one you go just be say then clamp your head, then grab your head, and it usually they affect everywhere. You just beat they just grab am, then they squeeze your head. That one na tension. Remember as the name be na tension headache. The other one we dey talk about, we say those ones migraines. Migraines usually then see dey affect one side of your head. With migraine, people some people dey vomit. Some people they go don't know say be like say I go get headache. Something go there's the way they feel they see light, their eyes feel they feel something, and then as that thing come through, the thing will just come and go they vomit, like that. And then usually one side, although it did affect both sides too, but the thing will be my dream is say the air go just do wow, 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 it go they throb. That's what they call throbbing. It go just wow, wow. That one there. Nah, migraine. I will get that one with the cluster headache. That one not they too common. That one they go they come here. I think they come in batches now. Go just come 5 minutes. It go hurt you. You go if you trouble, but you go come. Go if your eye feel they come out water. One side go just they pay that now, and then he leave you. He come again. Why grab you? You like say then they throw you arrow. That's when, but you understand now. No be arrow. Now cluster headache. That one be so that one those no, and then we have some other types. If you primary, and then we get secondary headaches. Now headache maybe say those one are 10%, 10%. That one we say something they cause the headache. If you remove that thing, the headache will go now. What do you mean secondary? One of the bad ones where they very dangerous. Now stroke here. When vessel burst for head, it would not be like saying now inside your brain thunder just sound para. That one and a problem. So secondary attention, infection, tumor of a brain. When tumor something they grow inside head. Because this space for the head no go expand. I just they grow, so you want to squeeze everywhere. As they squeeze everywhere now, the thing go cause pain now. So that pain go just they come small. You go just they door. You know they go away. You know they just they there. That one feel suggest say something they inside that head. So all those things now him be all the problem we don't talk about. We don't say Coco we say, make you know say all headache no be the same one. If you see some of the flags we don't talk about, say something else, you get headache, it's gonna pain you for another part of your body. Eh? You're gonna get fever. Eh? You're gonna see double. You know they see well again. I beg you. Make you don't see your doctor down a red flag, red flag. You do over 40 and then they just suddenly start. Then you go see your doctor. You go find out waiting they cause that headache. Or you can't see, say, the headache don't start and it can't be worse. It can't be worse. You know they get better. You know they go. It can't be worse. As they come, maybe like say round we go. You know the people go say round we waka go back as it come and force they come. If the headache they be like that, make you go see your doctor. We don't say the things where we go do make you relax. Make you find ways to relax and especially for the ones what those primary headache, tension headache, cluster headache, migraine. Find things to relax. Then go help you overcome them. Music and if na medicine, make you careful with medicine. If you dey take medicine, even those medicine, if you don't careful, then they cause headache. Too much medicine will give you headache. So make you see your doctor before you start to self-medicate. Okay, well, we have some questions. Thank you, Temitope. Thank you for joining us. What about headaches that affect only part of the face and come only at a particular time of the day? So we need to find that. So that, like I said, tension headaches, cluster headaches, or migraines migraines are funny enough. Cluster headaches are commoner in men, and migraines are commoner in women. So if we are now, you will need to see your physician and let's find out what's causing that headache. How long has it been? Because I will not be able to know how long has it been. When you say one part of the face, which part of the face? How does it come? How often does it come? What is the character of the pain? Is it throbbing? Is it constant? Because there are a lot of structures in the head. Some of it could be referred because is it your teeth that is paining? Is it your tonsils that are paining you? Is it when you say particular time of the day? Is it when you go to a particular place and maybe the temperature change in that place? Because tonsillitis can give you headache and it will be. So we'll need to find out what part of the face, what time, the character of that pain. But if you have been having constant headaches for a long time, for a long period of time, on a particular part of the face every day, I think that qualifies for you to go see your doctor. Let's even make a diagnosis and say, okay, we think this is a migraine, or we think this is a cluster headache, or we think whatever it is, or this is whatever it is, so that we down okay, because the treatment will differ. I hope I've answered your question. If you are not still happy, satisfied with what I've said, or you have additional details to share, you can share them. Is not normal to have headaches in the morning just waking up. We won't like that. So we need to find out why are you having is it something that has to do with your posture? Are you having postural hypertension or postural hypotension as the case may be? So what is it about when you wake up is it the way you are waking up? So is it your alarm that is waking you up and triggering a stress response? Because it could be something simple. It could be that the stress, what happens to you when you wake up, that's giving you a headache. So I wouldn't worry. Some people may say, "Oh, maybe it's this diabolical stuff." I don't think so. You can say that. Yeah. So we need to find out what is it with the mornings, because as you rise up from your bed, what is it with your BP, your whatever that is causing you? Is it just the way you wake up? Is it the alarm that wakes you up, or is it the way you are woken up that is causing you to have headaches in the morning? Or is it an infection? Is this whatever it is? We will now need to investigate that. But you shouldn't be having headaches every time you wake up in the morning. So we need to get to the bottom of that and solve it, right? Julian, thank you for asking that question. Is there any other question? Do we have any other question, or we bring this session to a close? Any other question? Do we have other questions? Right. Do we have other questions? Okay. If there are no other questions, a big thank you to everyone that has joined this stream. This will be put up available for viewing. You can watch it and you can still continue to engage with it. We'll be monitoring the questions to answer. Somebody asked a question last week about hepatitis, and I didn't see it until when the session ended. So hepatitis, we have a lot of content on hepatitis B on the channel. Go ahead, watch it. You can go to the hospital. Screening is available. Management is also available. Of course, vaccination is also available. So get vaccinated if you are not, if you don't already have the virus, so that you can prevent it. Certainly there are some food. Can a person's diet cause headache? Yes, what you eat. What if, like you said, some substances, coffee is, some people have coffee as a result of and can lead to headache. Anything that is psychoactive, um, that can affect the brain, affect your brain function, and can cause headache. Alcohol can cause headache. Hunger. I know some people, that's how they know they are. Hunger, of course, we can cause headache as well. So it's a complex disease, like I said, primary. So all these things can lead to tension headache, can lead to migraine, can be the trigger. So find out what that trigger is: your diet, environment, mood, even mood. Getting, if you are in a stressful environment and you feel pressured, you feel stressed, you can be tipped over to having a headache, right? Okay. Any other question? Any other question? Yeah, school fees. Well, the pressure of school fees, somebody said the fear of school fees is the beginning of family planning. Yes, school fees can cause can it. Okay, so what we're going to do next week on Living LTV Live is a question and answer session. So we'll just be taking questions. People can send in their questions before now before the program. That's next week, Friday, and 3 p.m. So it's ask anything from any. If you ask me for money for school fees, I might not. Well, who knows? Who knows? With God, all things are possible. Okay, so next week on Living LTV is a Q&A. It's ask anything. So we would maybe share a little bit on something general, but usually what we'll be taking care of is questions. We'll bank questions before then, and then of course we also have questions live that we can ask. Next week, Friday, will be Q&A. Thank you everyone that's joined in live. We need to bring the session to an end now. We spent 7 minutes, which is good. I think I prefer, although we don't have all the lower thirds and the names and the flags, but this has been, I think the viewing has been better. Julian, Amaka, Temitope, Michael, and every other person. I know I might not see some people that are online. Has the streaming be better for you today compared to the other times that you have viewed on the videos? I'd like to have your feedback if it has been better. If you could hear me better, if you could see better, if you could follow better. Can I have some feedback? If we are still online, I think I can see some people are still online. Has it been better today? Okay. All right. Thank you so much. I'll need to leave now. God bless you. Have a beautiful weekend. Until we come again next week, stay healthy. And as area doctor will say, remember, say, life, you know, get duplicate. God bless you.